Vaccines have made some childhood illnesses rare, but many others remain a fact of life. They range from common infections like croup to mysterious ailments like Kawasaki disease. In this video, we look at some common illnesses among children that parents should know about. 1. Respiratory syncytial virus, RSV. This is a virus which causes respiratory infections such as bronchiolitis and pneumonia. Globally, the cases of RSV infections are on the rise, which is fueling the demand for rapid diagnostic techniques. The infection begins with flu-like symptoms, including a fever, runny nose and cough. Up to 40% of young children with their first RSV infection will develop noticeable wheezing, and up to 2% will require hospitalization. According to the CDC, each year on an average, RSV leads to the hospitalization of around 132,000 to 172,000 children below the age of 5 and the death of around 14,000 adults above the age of 65, in the United States alone. 2. Ear infection. An ear infection is an inflammation of the middle ear, usually caused by bacteria that occurs when fluid builds up behind the eardrum. Anyone can get an ear infection, but children get them more often than adults. 5 out of 6 children will have at least one ear infection by their 3rd birthday. In fact, ear infections are the most common reason parents bring their child to a doctor. The scientific name for an ear infection is otitis media. The symptoms include fever, fussiness and ear pulling. Many ear infections are due to viruses and go away on their own. However, if it lingers or is thick and glue-like, it can interfere with a child's hearing. Childhood vaccinations help prevent infections from certain bacteria that can cause ear infections. Some ear infections require treatment with an antibiotic. 3. Croup. Croup is a common infection in children. It causes swelling in the upper part of the airway in the neck. It causes a barking cough, with or without fever, and it may cause problems with breathing. The illness is seen more often in the winter. Croup is spread through direct contact with an infected person or their body fluids. The infection starts in the nose and throat and moves into the lungs. If breathing becomes severely impaired, hospital treatment may be needed. However, most kids get better on their own in about a week. Croup is most common in children under 4. Hand, foot and mouth disease. Hand, foot and mouth disease is a common viral infection that causes painful red blisters in the mouth, throat and on the hands, feet and diaper area. HFM is contagious and easily spreads to others through contact with unwashed hands, feces, saliva, mucus from the nose or fluid from the blisters. Kids under age 5 are most at risk for HFM, as infections are common in childcare centers, preschools, and other places where kids are in close quarters. Besides the blisters, kids often have a fever for a few days and can get dehydrated because it hurts to swallow liquids. Symptoms usually clear up within a week and kids recover completely. 5. Pink eye. Tearing, redness, itching, and crusty eyelashes are all signs of conjunctivitis, commonly called pink eye. Often caused by the same viruses as the common cold, pink eye spreads rapidly in schools and daycare centers. Consult your pediatrician to determine whether your child needs treatment. Most cases clear up in 4 to 7 days. 6. Fifth disease. Fifth disease is a mild rash illness caused by parvovirus B19. It is more common in children than adults. A person usually gets sick with fifth disease within 14 days after getting infected with parvovirus B19. This disease, also called erythema infectiosum, got its name because it was fifth in a list of historical classifications of common skin rash illnesses in children. You may get a red rash on your face called slapped cheek rash. This rash is the most recognized feature of fifth disease. A rash may also appear on the torso, arms, or legs. The human parvovirus B19, a virus that may cause mild cold-like symptoms before the rash is seen. Once the rash appears, the child is usually no longer contagious. Up to 20% of kids get it by age 5, and up to 60% have had it by age 19. 7. Rotavirus. Rotavirus is a type of infection that's most common in children under the age of 5. It's highly contagious and easily transmittable. While it occurs most often in young children, adults can also get the infection, although it's usually less severe. The Centers for Disease Control and Prevention reports that before the rotavirus vaccine was introduced in 2006, the infection led to the following yearly statistics in children age 5 and younger in the United States. 400,000 visits to the pediatrician, between 55,000 and 70,000 hospital stays, at least 200,000 emergency room intakes, between 20 and 60 deaths. The vaccine is over 90% effective in preventing severe rotavirus disease. The rotavirus isn't treated with medications. It usually resolves on its own with time. However, dehydration is a serious concern. 8. Kawasaki disease. Also known as Kawasaki syndrome, is an acute febrile illness of unknown cause that primarily affects children younger than 5 years of age. The disease was first described in Japan by Tomisaku Kawasaki in 1967, and the first cases outside of Japan were reported in Hawaii in 1976. Clinical signs include fever, rash, swelling of the hands and feet, irritation and redness of the whites of the eyes, swollen lymph glands in the neck, and irritation and inflammation of the mouth, lips, and throat. 9. Chicken pox. Chickenpox, also known as varicella, is a highly contagious infection caused by the varicella zoster virus. There is a blister-like rash, which first appears on the face and trunk, and then spreads throughout the body. Although not life-threatening, complications can arise. 10. Measles. Measles is a highly contagious infectious disease caused by measles virus. Symptoms usually develop 10 to 12 days after exposure to an infected person and last 7 to 10 days. Initial symptoms typically include fever, often greater than 40 degrees Celsius (104 degrees Fahrenheit), cough, runny nose and inflamed eyes. As these symptoms fade, a full body rash appears. Most kids get better in 2 weeks, but some develop pneumonia or other problems.